This is my bioethics case presentation. I chose case 1, genetic testing and privacy overview. Some of the overview details on it are bioethics were started in the 1950s after all of the experimentation that happened in World War II during the Holocaust. Also, moving to more modern day, the University of California, Berkeley attempted to do DNA tests on all incoming freshmen, and that was ended. The military has many different DNA tests for different purposes, and genetic testing has become incredibly thorough and specific. So I'll go from the start. So as I stated, bioethics was created after the end of World War II, after the United States discovered all of the horrific things that the Nazis did to the prisoners, for all the medical experiments, like testing how long people can go without water, and food, and all those different things. And from that stemmed the desire to have more informed, consensual experimentation, autonomy, and justice. So bioethics is all about doing what's best for people and like the greater good, essentially. It also includes medical and biotechnologies because it needs to go over whether certain technologies that are being created are being used ethically. Are they going to actually help people? Are they going to benefit that greater good? Does it allow for people to make their own decisions? In all of that. But some things include like remote contact physicians and genome sequencing. So I know like right now, a lot of, especially with COVID and everything, a lot of people are remotely contacting their physicians, which is something that we couldn't do like even 20 years ago. It wasn't as common of a thing. And so now people can do that. And it requires a lot of ethical thinking because it's all online and it's a lot of personal information that's going out and it is online. The next would be the student testing. So the University of California, Berkeley sent out DNA kits in 2010, the summer of 2010, to all their incoming freshmen to take to see if their ranges on alcohol metabolism, folic acid intolerance, and lactose intolerance. And it was because it was voluntary, it didn't require consent. Well, it was voluntary, and because it was for data purposes, so they didn't require any consent. But a lot of genetic groups and bioethicists, people who look at policies, were protesting because they found it like against people's rights to just have this data be collected. So the Department of Public Health required them to have these tests done by licensed medical labs, which would have greatly increased the price of what they were originally planning to do. So University of California, Berkeley decided to shut the whole program down. And it was even that the test could have resulted poorly because people could have gotten back, like especially with alcohol metabolism, if certain people found out they had a higher metabolism, that could have increased drinking levels. Next is the military. And so they already have been testing recruits for the military for years now, mainly for G6PD carriers and sickle cell disease carriers, because some people are react poorly to anti-malaria medication as well as high altitudes. And currently they're doing more and more studies to ensure the safety of the soldiers before putting them into any sort of potential risk areas. And they're hoping to further that to see if more soldiers are at risk for PTSD and depression, so they can help with that in advance. A lot of the medical advances that we have, like in the past, they could only have like a handful of genes that they could discover. So people's identities were a lot more protected, especially in like criminal cases. It was harder to track them down. So now that we gather a lot more of like different pieces of genetic info, a person's individual genotype will be placed in a certain group. So you can go to a certain neighborhood and just narrow it down completely to find one specific person, especially if they have a disease or a strange mutation. And on to the questions. Question 1 was, if a genetic test reveals a mutation that could harm a blood relative, should the first person's privacy be sacrificed to inform the second person? I personally don't think so, due to doctor-patient confidentiality, unless the first person has given consent or they are a minor to have, and that way the second person would have access to their records. But it is kind of a breach of security and like that personal information. Question 2, under what circumstances, if any, should a government mandate any type of genetic testing? This is kind of tricky in my opinion, because genetic testing can be done for the greater good, but also can lead to conflict between the public. I don't think that the government should be able to really mandate it, at least not like on an entire group of people. It's just kind of, it's a gray area that I don't think that we're quite ready to go into yet. Question 3, some student athletes have died of complications from being carriers of sickle cell disease. What are the risks and benefits of testing student athletes for sickle cell disease carrier status? There's a lot of benefits, because it would include discovering and possibly treating them effectively and to keep them from dying and being sick. I personally couldn't think of a lot of risks for the testing, besides maybe the school would have to provide that financially and would hurt them financially, and maybe losing some of their athletes. But I think it's more of there's more benefits than there are risks. Question 4, do you think that passenger screening at airports should include DNA scans? I think that's a very difficult subject, and I don't think it's a good idea, because even right now with the pandemic we have going around, people are freaking out over everybody. They were worried about Chinese Americans, for like just the fact that it stemmed from China. And so, people react for a lot less information. So giving more information, seeing that people could, be like refused off the flight, people be like freaking out, like, oh my gosh, are they sick? Like, what's going on? And I think that there's a lot of suspicion that could go through with that. In question 5, exome sequencing to identify a mutation that could cause a particular set of symptoms in a patient can reveal another genetic condition that has not yet been detected. Under what circumstances, if any, do you think patients should receive such secondary findings? I believe that a patient should be given the option to sign a waiver if they want to receive the second findings or not. That way they have that choice. But I do believe that they should have the right to choose or not. But the waiver would also have to include that, certain stipulations, like if they do want to find out, it doesn't mean they can necessarily get a cure or a treatment for it, but they definitely should have access to all things about their health. And that is my presentation for you. Thank you.